So I may have a bit of a controversial take on this as an ultrasound tech. My clinic, in my opinion, thankfully, does not have TV screens on the wall where the patient can go ahead and watch the whole exam. I do understand that there are some clinics that are like this. When I was scanned at the high risk maternal fetal medicine center for both of my pregnancies, they did have screens on the wall so that we could go ahead and watch the whole exam. But as an ultrasound tech, I would actually hate this. And let me explain why. So, when things are going normally and things are all peachy keen, fine. I don't really care, honestly, either way, if there was a TV screen that the patient could see everything that we are doing. But as you all may know, that is not always the case. As in, that is not always the case where everything goes smoothly. And it is already a devastating thing to have to go ahead and grab the radiologist and have them explain to the patient that things are not what they were expecting. This happens in cases of no fetal heart rate detected, is when the radiologist would come in, or with severe defects that the patient would for sure notice if we went ahead and showed them baby at the end. In those cases as well, we would need to go ahead and grab the radiologist so they could come in and talk to the patient. And in my opinion, if we had those TV screens on the wall where the patient could go ahead and see everything during the entire exam, I think it would be harder not only for the patient, but also for us as the sonographers who are trying to document what is going on in the medical sense. And I think if we ever were to have TVs in our clinic, we would have to make it a rule, or I guess we wouldn't have to make it a rule, but I would like to make it a rule where we would turn the screen on about 10 minutes into the exam or even after a quick sweep just to make sure that we can see everything is okay and there isn't something that is super detrimental that we are having to document while also simultaneously trying to hide from the patient so that we are able to get the full extent of what is happening without the patient freaking out or questioning everything that we are doing. Even in cases when things are totally normal and we are trying to get our images, especially I think of in an anatomy scan where we take upwards of 120 pictures, it can be super distracting when we have a spouse that is in the back, and often they can go ahead and obviously watch our screen because they are behind us and they are seeing everything that we are doing. And it is so distracting when someone is sitting there questioning every single thing that we are doing when we are trying to concentrate and do our job. So I can imagine that that could be really amplified for some exams if we had these screens on the wall. From a patient perspective, I can also be empathetic and understand that it would probably put the mother's mind at ease in normal exams to be able to see what we are doing on the screen, even if they didn't know what we were measuring at the time or what was going on. But just from a purely, I guess, sonographic point of view, I'm really glad that we actually don't have these screens for the patient to see everything on the wall and that we are able to go ahead and take the pictures that we need for the medical portion of the exam first and not have more of these questions thrown at us as to what we are doing on the screen, etc., when we are really just trying to give you your best exam possible. And on that same note, especially when things are wrong, then the patient isn't sitting there freaking out or questioning what is happening when we can't give you results in the first place. We are really just trying to document to the best of our ability when things are abnormal and then go and grab the radiologist after if it is news that needs to be relayed to the patient right away. And I really hope I am not coming off as cold or callous when I am saying these things. I am a mother myself. I have had very, very stressful pregnancies because of both of my daughters having increased nuchals, and also I have experienced miscarriage in the past as well. I am very much empathetic as well to the patient side of things. But at the end of the day, with my job being an ultrasound tech, being a sonographer, Patient care does come first in the form of trying to document exactly what is happening, and it does make our job infinitely more difficult if there is a screen on the wall and things are abnormal, and if things are going south and everybody can see what's happening on the screen. Um, that's just how it is at the end of the day. Maybe be a little bit different if we were able to give the patient results or be able to explain to the patient what we think may be happening on the screen. But when there is that kind of, I'm not going to say disconnect, but when we can't give those results and they are questioning what is happening, but we can't tell them, it basically just creates that much more of a crappy scenario for everyone. So, long story short, I am glad that we do not have screens in our clinics for the patient to watch everything that is going on in the exam. If we do end up getting them in the future, then I really do hope that we have some sort of policy in place where we can go ahead and take the pictures that we need first before turning on the TV, or we can have a little bit of a grace period at the beginning just to make sure that it is even appropriate to turn on the TV for the patient to see. And also, just as a final little side note, just because this is just my opinion on TV screens, that does not mean that I am all against them, as I hopefully mentioned in the video. It's not just all black and white. It's not that I'm against them completely. And at the clinic that I work at, we don't have them on the wall. And that doesn't mean that the patient is getting a bad experience from us. After we take all the medical pictures, we absolutely do go ahead and turn the screen so that the patient, as well as whoever they are with, can go ahead and see the screen fully. I show them everything on baby that we can. And then we also text pictures and we print off a picture too for the patient, as well as we let them record a video at the end. So we do prioritize patient care in the sense of giving the patient a good experience as well. It's just the whole TV screen thing. Obviously, you know my opinion based on what I have said in the video, but that is not to say I am totally against them, but I am also definitely not for having them just be on the whole time for the whole duration of the exam.